Thanks again for having us here today. Thank you to everybody in the Medicaid Innovation Collaborative and all of our Medicaid leaders who are doing so much to provide services that are accessible to all people. That's really the foundation of our work here at Workit, is that we wanted to make treatment solutions that are affordable and accessible to all members who are in need of care. And when we're speaking specifically about this population of maternal care, we know that there is a growing need. We know that women who are in childbearing years are at greater risk for substance use disorder. We also know that the rise of mass births is happening nationally. So there's this growing need for substance use disorder care, for maternal care, but we know that not enough women are getting the care that they need because there's privacy concerns, because maybe they have other kids at home that they're caring for, because they cannot afford a 28-day inpatient stay. And so because of that, Workit has developed a unique program to specifically meet the needs of women. We are a telehealth platform. We're virtual first. We provide services that are online, on demand, and evidence-based. They're online, so all you need is a smartphone or a laptop to access our services. And if you don't have a device to do that, we have a team that will help you connect to the technology that you need. We're on demand. So our services are on demand 24 hours a day. This includes support services like wraparound care, messaging, educational content that's going to be curated to the members' needs. And then we're evidence-based. So we combine things like MAT treatment with other forms of therapy. To give you a little bit of an overview of where we are today at Workit, we are currently in 17 states with our MAT program. We will be in all 50 states by 2023. We are also in about 25% rural communities across the country. 60% of those members are Medicaid members. And we will be in Hawaii by Q1 of 2023, which we're really excited about. And what I wanted to mention here, what I wanted to point out is that while we are a virtual first solution, we take great care when we go into a new community. So it's a priority for us every time we do go into community like Hawaii, that we make local relationships with different community organizations, that we hire local clinicians, whether that's an MD or a PA, and that we make those ties within the community so that we can really meet the individual's needs, whatever that might be. I'm going to take a few minutes here to walk us through what the member journey might look like, especially from a maternal perspective, a woman who might be coming to us throughout pregnancy, who needs an additional level of care. So our members find us one of three ways. They find us online, they find us for referral, or they find us through one of our partners. We're really proud of the fact that a third of our referrals come from word of mouth from loved ones who have been through the program. So most members who do find us, when they come to us, we make the sign up for them quick and easy. It's no more than 3 minutes. And we do that by design because we know that the window of willingness is very small and that you want to be able to take advantage of that window. For instance, Maggie here on her right-hand side is a single working mom. She works long days, she works long shifts, she's got several children. She doesn't have the time to go away to inpatient stay, and she doesn't have the time to really be a part of that process to sign up. But we need to make it as fast and as easy as possible for her. So Maggie finds us, she signs up, it's 3 minutes. And what we do from there is we get her to an immediate assessment. We do same day, next day assessments where she's going to meet with a care team member. And they're going to walk her through the intake process. This is going to look at what sort of drug usage does she have in her history? What other sort of physical issues might Maggie be having? We know that 80% of members who come to us have at least one other coexisting condition. This is oftentimes in women, anxiety and depression, but can be other things as well. And so we really want to make certain that we are getting the holistic view of Maggie. In addition, we're going to ask for social determinants of health questions. What's going on at home? Does she need additional community resources? Does she need additional help, additional care? And from there, we're going to create a custom treatment program to meet Maggie's needs, especially if we're talking about a woman who is in pregnancy. We know that there are additional levels of care and support that they're going to need as part of that program, which we'll talk about a little bit more here. So in speaking about Maggie, she comes to us, she's had her initial assessment. She goes to see her initial clinician. We have a really wonderful team of clinicians here at Workit who are trained to work with our pregnant moms who come to us on opioids or other substances who need that level of care. So they're going to be able to meet Maggie where she is and provide the level of care that she needs. They're going to be able to provide safe MAT treatment to her or other forms of treatment that she might need. If Maggie already has an OBGYN, we will work with her OBGYN to ensure that there's a continuity of care. 65% of members who come to us don't have a primary care physician or any other type of relationship with a doctor. So there's a good chance that we might also have to find an OBGYN for Maggie. And in that case, what we'll do is we will go to our local community resources, other network providers that we know are addiction savvy and will know how to work with Maggie. And from there, we put together a treatment plan to meet her needs. This is going to include wraparound care that's going to look like a birthing plan, pain management plan, anything that she might need as part of her pregnancy to ensure that she's going to be successful in her treatment program here at Workit. And then in addition to her clinical support, she's also going to get a lot of support from her community. We have weekly support groups. These are really important because we know, especially those who are starting out their foundation of recovery, that peer recovery is very, very important. And so we've designed a number of different support groups that are going to be made to meet our members' needs, whether that's, about breastfeeding or about new mommy support, about babies, whatever is needed for the group. We have that morning, noon, and night to fit into the schedule of our members. And then in addition to the support groups, we also have educational content. So we have up to 1,000 pieces of educational content in our library. We have made special and specific educational courses for our expecting moms. So this is going to go over, in addition to substance use disorder, it's going to go over things like breastfeeding, how to care for a newborn, any sort of education that will be helpful for them throughout pregnancy, labor, delivery, and post-delivery, because we know that that is also a very critical time in a woman's journey is after she gets home with baby. So we really want to ensure that the care that we have for her doesn't stop there, that we continue it post-birth as well. In addition, we have 24/7 care, and we have 24/7 automated drug testing. This is really important to us, especially when we're speaking about moms. We are speaking about a group who might not have the time to go to a lab quest, for example, to drive an hour out of their way to do the drug testing. So we've really created features here at Workit to uniquely fit into the life of our member, to break down those barriers of care, to meet a member where they are and get them the level of services that they need in that moment. So for example, we have 24/7 care messaging with our care team members. So if a member came to us, if a mom came to us and she was having a moment of crises or feeling triggered, what she could do is she could pull out her phone and she could immediately message with her care team and get a response that she needs. I was actually just talking with one of our clinicians about this because she was actually messaging with one of our members who was in labor, was going to the hospital to give birth. And so it's a really unique and special feature that is important, especially when speaking about moms who are expecting. We want to be able to be there for them in the moment that they need it. Same thing with automated drug testing, is that we want to make our services as convenient as possible for the moms who need our services. So automated drug testing is a new feature here at Workit. Moms can take their drug tests whenever they need to from the comfort and privacy of their own home, which we know is very important. And then they can send it off to Workit, where they can work with the care team member to go over the results, to talk about their treatment plan and anything else that they might have. So our approach to care for maternal care, for meeting moms, is really to meet them where they are, to provide that comprehensive level of support, whether that is substance use disorder, whether that is wraparound care for coexisting conditions, whether they are primary nature, psych in nature, and then also provide a level of support for them to help them to ensure that they have not only success throughout their pregnancy, but also throughout labor, delivery, and after birth, when they get home, to ensure that they feel supported, that they have that level of care, resources through education, through community resources, through our education, through our care team members, anything that they need to be successful here at Workit is what we want to provide them. And because of that, we are seeing really great outcomes across the board. So for example, with our Medicaid members, we're seeing a 90% average engagement rate, which is really high, well above industry standard. We're also seeing things like a 70% adherence rate, which is medication they're supposed to be taking and medications that they're not supposed to have in their system are not in their system. So we're really happy to see this. Net promoter score at 68. That means that our members are happy that they're thriving here at Workit. And because of that, we know that they're having better outcomes, that mom and baby feel supported, and they feel set up for success here. And I like to just end with a member quote. We have an inspiration channel here at Workit where it's a daily reminder of the work that we're doing here. Most folks here at Workit are very tied to the mission. We're a very mission-oriented organization, and we feel deeply committed and passionate about the work we're doing here, especially with our moms who we know need that level of support. And we're really grateful that we're able to meet them in that level of need and provide the services that they deserve. And again, I want to thank you so much for allowing us to be here today. On behalf of myself, Robin and Lisa, and the entire Workit team, we thank all the Medicaid leaders who are out there doing wonderful work to provide services that are accessible to all people. Thank you so much.